I think we've gone live.
And good afternoon, everyone. Welcome to Out and Equal and our session today on increasing LGBTQ inclusion through affirming healthcare access and benefits. We're going to give a moment or two as people kind of come through the virtual doors. So come on in, take a virtual seat, and we'll get started in just a moment. I do want to mention we will be using Mentimeter today. So if you have your handheld device or can open another browser window, jump into menti.com and we will chat out the Menti link for you, the code. Would love to have you participating, giving your input today to this session.
Can folks in the chat also just verify that you can see the screen here too, please? Thanks, Jillian.
Woohoo, everybody can see the screen. Looks like the room is starting to stabilize a little on the count. And we just need, if we could, Alon, could you give me that Menti code?
Sorry, I'm responding to you. I can't grab it right now. Karina, can you just ping that link that I pinged in the chat here?
Yes.
Thank you.
Thank you. All right, everybody, let's go ahead and get started. Thank you for taking time to join us here on this session to talk about inclusive benefits and how to make accessing benefits more equitable and easy for everyone. My name is Beck Bailey. My pronouns are he and him. I'm a managing director of inclusion and diversity at Accenture. And I'm really excited to be here with my panelists today for this conversation. One of the things that I'd like to do is give a quick overview of our agenda and then ask everyone to introduce themselves a little more fully. As we're doing that, if you could jump into that Mentimeter, go ahead and give us a little bit of your feedback of where you are today. And that will give us a little bit of a pulse check as we go into the session. Today, we are going to spend just a few minutes talking about the why, a little bit of the business case for those of you who maybe are newer to this conversation, some grounding in how we talk about this with our leadership in order to make that compelling business case for benefits. Then we're going to spend quite a bit of time around the what. What do inclusive benefits look like? What are the various kind of buckets, if you will, of major benefit costs that we want to address? And then we're going to look at the how. How do we make this work? How do we make it better? How do we make it easier as LGBTQ employees and for our family members, our dependents, to access these benefits? And then lastly, we'll leave you with a few additional resources for the conversation. Now, all the way through, we're going to have time to interact. And what we're really going to look for is your questions. You know, where are your pain points? What is it that is causing friction in your benefit access or plans? And we're going to try to help weigh in on resources for those, on answers to those, both from our companies and our individual learning journeys around this, but also crowdsourcing with all of you in real time to get the very best practices bubbled up to the surface. For Mentimeter, if you have a browser or your phone handy, open a browser and go to menti.com, MENTI.com, and put in the code that Colin has chatted out, 13971224, and you can answer polling questions in real time that we'll be able to share here, and it's all anonymous. So, feel free to put in the hardest questions you've got, and we will take our best shot at them. Let's go ahead and introduce everyone today. I briefly touched on myself. Just a little bit about me. Some of you may recognize me from last year at Out and Equal, where I wore a different hat for our friends at the Human Rights Campaign. I used to be the director of the Workplace Equality Program there and worked on benefits with many, many companies across our Corporate Equality Index. I've switched seats here recently, joining Accenture just 6 months ago, but I'm super excited to continue the work, right? The work is, how do we all, as LGBTQ people, as allies, and as advocates, help each other advance the conversation and the narrative? With that, I'm going to turn it over to my colleague and friend, Alon Mieslik, to introduce himself. Alon?
Thanks, Beck. Hey, everybody, and thanks for joining us today. As Beck mentioned, I've had the pleasure of working with him in both his old role and his new role, which is really nice for me. I'm a managing director at Accenture as well. My day job is actually focused not in inclusion and diversity. I'm part of our technology strategy practice, and so I spend my days advising clients on tech strategy, but I lead our US Pride ERG, which is one of our largest ERGs globally. And I've been doing that for a couple of years. And so that has me working very closely with partners in I&D, partners in HR and the benefits team to make sure that we're advocating for our LGBTQ people. So that's my side job, which has me very engaged in this space as well. So thanks everyone for inviting us into this conversation and allowing us to share a little bit of information in this space. Melinda, over to you.
Thank you. Hi, I'm Melinda Morimoto. I'm the Senior Director at Genentech. I manage our U.S. benefit programs. I use she, her pronouns. We are, as a company, bold change makers, and we are very committed to diversity and inclusion. It fosters innovation, which is essential to our business. So I was really honored to be asked to share some of the things in the work that we're doing in Genentech and our journey in becoming a truly inclusive environment. So I'm looking forward to the conversation today, and I'll turn it over to Colin.
Thanks, Melinda. Good morning, good afternoon, everyone. My name is Colin Quinn. I use he, him pronouns. I'm the CEO and co-founder of Included Health, based here in New York. And sharing a little bit more about Included Health, we started the company back in 2019 with the focus to create a better healthcare experience for members of our LGBTQ+ community. So very excited to be part of today's panel, part of this important conversation with my fellow panelists here. And excited to have the opportunity to hopefully provide some very valuable information, understand and hear from some of our audience on what questions you might have, what are some of the answers we might be able to provide for you. And also, of course, happy to connect afterwards as well. So thanks, everyone.
Awesome. All right, Alon, if you don't mind sharing some of the results from our Menti. I know that folks are getting their information in, and let's see what we've got here. Okay, how are we feeling so far at Out and Equal, everybody? Well, I love the energy in the room. There's energy, there's readiness, there's some eagerness. For those of you who are a bit overwhelmed, I certainly can relate. It's managing kind of the day-to-day of our jobs, and then also having this incredible opportunity to attend Out and Equal and all of the incredible programming that Out and Equal puts together for us. It can be a tad overwhelming. Here's the great news. There's so much content, and one of the things that's amazing about virtual Out and Equal is you've got the whole month basically to come in and out and take the content. So do the best you can to plug in today. And if you have to come back and rewatch this session, it'll be there recorded for you to check into later. So glad to be here with you. And let's go to the next slide and see where we're at. We wanted to have a sense of your role at the organization and what your kind of day job is. I see we have a lot of our ERG, BRG, CRG team network folks here. And, you know, that's not surprising to me in terms of out and equals demographics for, you know, the organization. You know, what's exciting about that for me, from my chair for this conversation, would be it has been historically, if we go back to the 90s, you know, LGBTQ employees themselves who have really changed the needle on this conversation about what inclusive benefits are. We are the drivers, we are the change makers, we are the voice of our community in our organization, and are really needed to bring the conversation up through the company. So totally happy to see the spread of folks here and understand that our ERG folks are a really important part of this conversation. But of course, so are our benefit people and our D&I people who are, you know, steadily making the business case and also trying to figure out how to make it all work. So got a great cohort here for this conversation. Let's see our next slide, Alon, if you will. All right, so the kind of geography of benefits that we're looking to address here, obviously a lot of folks focused here in the US, but you can see a pretty decent representation across the rest of the world. I know at Accenture, that is part of our mandate and challenge as a global multinational company, how we have a common core of benefits across our footprint, as well as maximizing our opportunity to make an impact around the globe. So we'll definitely touch on some of these things as we go. Obviously, I think a lot of this conversation is anchored in North America, at least, or the US more specifically, but we will also try to answer questions from a global perspective. All right. Let's go into our business case. Here's a picture of my partner and I. And I just want to say, you know, from the aspect of visibility, I'm a transgender man. My partner is a queer woman. So we are buyers, users of LGBTQ inclusive healthcare. And so it's important to us to think about it inclusively and as individuals, as well as in my role as an I&D professional. So let's talk about that business case. Alon, I think I'm going to go to you first and tell me, you know, how is Accenture thinking about this in the why?
Yeah, happy to. And I'll start by acknowledging that there's probably a lot of different maturity and size and scale of organizations in the room with us today. And the concept of a business case ranges widely in this space, right? I joked yesterday that some companies require a business case for this stuff. Others say it's the right thing to do. And then there's some in between that say it's the right thing to do, but still require the business case. So it's probably worth acknowledging that there are a lot of details around the impact of inclusion, diversity, and equity, and the impact of making gains in those spaces on employee retention, on productivity. And those stats are out there and published. Some of them are referenced here, and I don't want to concentrate too much on the left side, which is more of the negatives, right? But there are also real consequences of lack of any sort of inclusion and equity in your employment that can produce real results, whether they're health, mental health, physical, as well as just impact on the work you're doing as well. So there are a lot of reports that people can reference at building a business case on the potential impact of what inequity in this space might look like, as well as if you flip over to the positive outcomes on the right side of the page, thinking about the big goals for organizations in general around hiring and recruitment and retention, team cohesion and engagement. There's a lot of science around inclusion, diversity, and equity and the impact there, as well as productivity. And then the last one here that I'll highlight too is really this newer concept in some of the research that's out there. And there's a study here that's referenced on the page, as well as the next one, around innovation and creativity And there's a lot of science that's showing that organizations that focus on inclusion, diversity, and equity have a major impact on creativity and innovation in the workplace, which is another important element of a business case for a lot of organizations today. So that's another one worth highlighting. And the last thing that I'll sort of mention here when we think about how we build business cases is also leveraging partners in the ecosystem. We're going to talk a lot about it later in the talk today, but a lot of the support services that are out there to help in this space and the benefits space are helpful, and they're trying to sell their product too, right? And so trying to lean on them to help build the business case. What are they seeing with their other customers and clients? If you're a prospective client or customer, how can you lean on them to help support building your business case in a way that's relevant to your organization? And sometimes just asking that question and say, what's important to our org is this, this, and that, and having them help shape a business case for it as well is also helpful. So just another little tip there. And then I did want to highlight, since we're talking a lot about benefits, a lot of the benefit space is on health as well. So ask Colin to weigh in here a little bit on what we're seeing in terms of the impact of some of these inclusion, diversity, equity stats, specifically in the health space too.
Yeah, absolutely. So as Alon mentioned, unfortunately, or I guess depending on kind of where we are within the evolution from a maturity of an organization, sometimes business cases are still required. But I love seeing so many DEI leaders and HR benefits leaders and organizational leaders coming out and saying, DEI is not a nice to have, it's a need to have. We need to stop worrying about developing business cases and getting bogged down by this and doing it because it's the right thing that we should be doing. So we'll be talking more about that. But what I would like to share here is, if you are needing some of that data and research to help inform a business case, we've got some data points here that we uncovered from an included health perspective. We actually conducted our own research study in early 2020, looking at the healthcare experience of members of our community, because unfortunately there isn't a whole lot of data and research out there looking at the employed, insured LGBTQ+ community. So we set out to be able to gather some of this information. In order to do that, we partnered with a handful of Fortune 100 companies and surveyed their Pride ERG members. Some of you on the call today might have participated in that research study with us. And what we found, and was really and is eye-opening to a lot of our DEI leaders and to HR leaders, is that our community is having difficulty accessing and finding providers who meet our needs. So 45% of members saying, yeah, I've had difficulty finding a primary care doctor that meets my needs, or 60% of people finding or having difficulty finding a mental health clinician that meets our needs. We know, unfortunately, stigma still exists within the healthcare system. There's a lot of work being done to move that process forward, but a number of members within our community are still being discriminated against in the healthcare setting. And what that results in is many of us decide to postpone or avoid care because it doesn't feel like a safe space. So of course, we want to ensure that there are solutions out there, care navigation solutions, to ensure that members of our community feel safe re-entering the healthcare system to get the care that we need. We know mental health is an area of added need and support for our community. So we want to ensure that we identify therapists, counselors, and mental health clinicians that understand us and can help navigate us through our journeys and care needs as well. And then lastly, a big business case data point for HR benefits leaders and organizations is understanding cost and utilization data. Given many of large employers are self-funded and managing their own costs from a healthcare perspective, because of all those previous data points that I shared, a lot of members within our community end up in the hospital and ER at much greater rates than the broader US population. And really what's driving that is the fact that we're not having those primary care relationships as often. So we're not going in for those routine screenings and healthcare appointments. So our needs go unmanaged over time until there might be that acute health episode, or we might just not have that primary care relationship. So we end up using the ER in those situations. So a lot of this can be avoided if we have those right points of care connection to identify providers that we feel safe, welcoming, and comfortable with, and understand our health needs as well.
Yeah, we have a couple of great questions in here about some of this work that you're talking about here, Colin. One I want to raise, like, in the chat, folks are talking about some of the barriers they face, right? Like, I have to drive over an hour to an inclusive provider. I have to educate my providers myself about my community and our needs. Couple of things. One is, someone's asking about the actual survey questions you asked in your study. Colin, can you talk a little bit about your methodology and what you were trying to achieve there?
Yeah, absolutely. So it is a proprietary research study. We actually submitted it to a peer-reviewed medical journal, and it's actually being written up because it is the first of its kind study looking at the employed, insured LGBTQ plus community. And really what we were looking to understand and uncover is, what is our current healthcare experience like today? What are some of the challenges that we're having in accessing that care? What are some of the health disparities that regularly impact us or we face? In an ideal world, what would we like our healthcare to look like, and how would we like to navigate our healthcare? So it's really looking at what is the current experience, what is the ideal experience, and then what are the needs that we're having, and then also being able to break that down by demographics, geography, and then also within the LGBTQ plus community, because recognizing we are a very diverse community, looking at intersectionalities as well, seeing how experience and need is broken down across multiple dimensions.
Yeah, thank you. And then I guess, because I know a little bit about some of the work you're doing there, I want to ask you, what is Included Health doing to help with that pain point around providers and their own knowledge of the LGBTQ community? I know you do a lot of education and awareness. Can you talk about that a little bit?
Yeah, absolutely. So I'd say we're focused in a couple areas because there's multiple ways we need to address the problem. So one is looking at provider education. Up until about a couple years ago, medical schools dedicated less than 5 hours of medical school curriculum to LGBTQ plus healthcare needs and health disparities. So there's a large provider education gap, and really it was incumbent upon providers to continue to self-educate themselves. And so we're finding more and more medical schools are increasing curriculum to make providers prepared to understand all member populations. But from our perspective in working with members, what we do is we have gone out and built our own directory of affirming and clinically competent providers nationwide in scope. So when we work with our members through our employer partners, is we've identified providers that we have personally vetted as an organization to ensure that they are affirming and clinically competent. So one, they're creating a safe, welcoming environment, but two, they understand us as people and our health needs, and they're proficient in having those healthcare conversations to ensure it's a good quality healthcare experience as well. So being able to identify those providers that meet our needs to be able to make it a much better experience is really what we're focused on. We have over 6,000 providers that we've identified so far nationwide in scope. But of course, recognizing that we want to be able to continue to add to that, recognizing that we want to be covering all geographies, all zip codes. I saw a note or a comment in the chat box about, I have to drive an hour to see a doctor. We don't want that to be a barrier to care. We want to ensure members, regardless of where you live, you have access to a provider that creates a safe and welcoming environment, but you're also able to get the care that you need and deserve. So being able to identify providers in all of those areas, and being able to have virtual care options as well. Recognizing virtual care doesn't solve everything, but oftentimes it does support a really great opportunity for members that maybe live in rural areas or in areas that are, unfortunately, we just don't have as many affirming and clinically competent providers yet.
Fantastic. Now I'm seeing a lot of great comments, a lot of interaction, and actually a lot of pain points, particularly for the trans and non-binary community, kind of coming up in the chat. I'm going to come to this in just a minute, because I think, I can see that there's a lot of energy there. But let's first kind of give context to the playing field, if you will, the what. What are kind of, when we talk about LGBTQ inclusive healthcare, what are we talking about? we really see kind of 4 major buckets, and understanding that there's some crossover here, there's some subsets here, but we're really looking at a major bucket around gender-affirming care and everything supporting trans and non-binary and gender-diverse folks in the affirmation of self, from mental health to pharmaceuticals to surgery, and a holistic sense of that care for trans, non-binary, and gender expansive folks. Then we're looking at family building and fertility, whether that's through surrogacy, adoption, fertility treatment, but also fertility continuation for trans folks, right? So this is where you get some of that crossover, right? LGBTQ youth and parenting, and here's where maybe we're not thinking so much about the benefit plans per se, although there are aspects of benefit coverage for, say, transgender youth, but also kind of the wraparound support that may be available to parents of LGBTQ youth who are members of your firm. And then lastly, mental health. And here again, certainly the aspects that are covered in the primary healthcare plan, but even thinking more holistically about mental health and wellness across the company, and how you're having a dialogue about that with respect to LGBTQ people. Let's go ahead and pull in our mentee again, and have you all kind of weigh in a little bit on where your head is at on today's discussion, so that we calibrate to your needs. Thank you for that. This, obviously we're seeing this in the chat around gender affirming care, and a lot of challenges there, quite frankly, still, and also around family building and fertility. But honestly, it's a little bit more equal. So we'll try to make sure we cover off on all of this. Let's look at our maturity curve here. And obviously this is how you define it. And it doesn't feel like anybody's hitting it out of the park, right? That's a good news, bad news, kind of issue to me. One is, don't feel like your firm is maybe way behind the conversation. I think we all feel like there's a lot of opportunity here and a lot of growth that needs to happen. And so the goal of today is how we help each other in pushing that forward. And Alon, do we have another, or is that we get into the kind of the open? Okay, great. We have some open fields here for you to kind of pull this through, and I'm going to look for themes in this. So if you could just kind of leave this scrolling while we chat, Alon, that'll help me. And I want to start with a question I saw in the chat that relates a little bit to all of these sections, but it circles back to you, Colin, on, there are some of your customers participating here, and someone said, hey, we've got included health, and we're struggling a little bit with the messaging. And even I, as an LGBTQ person, am a little hesitant to reach out. Do you have some best practices or thinking that you can share with folks on if they are engaged with included health, how they can deepen employees, say, trust in working with you, and also maybe some of those messages more broadly for folks?
Yeah, it's a great question. And we recognize each company is a little bit different in the way that they allow us to communicate and offer messaging around the benefit of included health available to employees. What I would recommend first and foremost is each each of our clients has a dedicated client success manager. So that individual is there to work with the HR benefits team and the Pride ERG leaders to understand what are the best messaging channels, how are communications going, how is awareness getting spread around, and being able to personalize and customize some of that for each organization, recognizing that there are some differences there. So what I would recommend is, if you're not your ERG leader, feel free to have a conversation with your ERG leader and say, hey, let's get connected. It's likely Cass, who is your client success manager, just knowing how our accounts are currently set up. And Cass, they would love to have an opportunity to work with your ERG leader and your benefits team to really identify some areas of opportunity. We're learning best practices across our client partners. In some cases, what we love to do is have those internal champions and advocates that have had a good experience with Included Health, being able to offer some support as well in some of those informal social channels as well. So whether you use Yammer or Slack or some other messaging system, oftentimes what we found really useful is kind of that social proof mechanism, to where an employee or a member can say, yeah, I've used Included Health and I've had a good experience. I would welcome or encourage you, if you have one of these many needs or just questions, feel free to reach out to Included Health. It's and if you feel comfortable kind of sharing, of course, no personal details or anything like that, but just kind of what your overall experience was there. And lastly, what I would say is privacy and confidentiality are of utmost importance. I think it's really important to call out that whenever we partner with an employer, our relationship is with you as the member. So we are not sharing any of your individual information back with your employer, and your employer is actually very much supportive of this. Of course, they're not wanting to know which employee is using the service and which is not, recognizing that there are some more sensitive matters that we as LGBTQ+ individuals are mindful of. So that's why it's incredibly important. And I want to make sure you all feel comfortable knowing that we handle your information with the utmost privacy, confidentiality, and security from that perspective.
Beck, knowing that most of the, or at least many of the folks listening today are in ERGs, I'd love to share a little bit of our story, because it was our G Pride group that really advocated in such a spirit of partnership. They did the homework. They came and said, we're not doing enough to support our colleagues, especially during a transition, and came with an outline for a guide and said, not only do we need support and how do I change my name? How do I share my new pronouns? But what we recognize from a people and culture and HR perspective is we wanted to give them an individual who would truly be their guide, their navigator through that process. And speaking with her, she said everyone's at a different juncture in their journey. And they need to understand, I mean, if you're going through gender-affirming procedures, it's complicated. The guide that we have with UHC is almost 20 pages long. And it's the how do you and what are the pre-approvals that you need. It's not a simple process at all. So it started with our Pride group saying, there's more we can do to be best in class. And when a leader says, we want to be the place to work for trans, I'm like, okay, so what do we need to do? So it started there. Then we have a dedicated team at United Healthcare with an advocate who is the right hand and says, I'm going to help through the claims process. Yes, it is United Healthcare Group. But that wasn't enough. We still had employees who are not finding providers that were even competent in the procedures that they needed. So that's when we brought in Included Health, and we involved our Pride leaders in disseminating the survey, in promoting the services. We had a lot of fun. From a vendor implementation, I'm going to tell you, is the most fun we had and the easiest experience we've had. But what we saw in our own data, we're a healthcare company, we're focused on disparities in care and how do we create health equity. 42% of our employees had a negative, of our LGBTQ employees had a negative healthcare experience. Fortunately, only 19% had avoided care. That's lower than some other numbers, but that's still disconcerting. And of our, 25% had challenges finding primary care physicians. So when we think about that ability to manage your full health care, that's a big gap if you don't have a PCP. In the first few months we've had Included Health, we've had 70 care requests So beyond what our United Healthcare offers and our dedicated health team, whose job is to connect our people with network providers, we needed included health to pull everything together and to provide that level of support. And the last thing I'll add is, as we were doing this, especially for our employees who are transitioning, we put together a care team and a one-page that shows what does included health do, what does our internal navigator do, what does the health plan navigator do, and what do the supports do Lyra mental wellness. So it's really this comprehensive, how do we provide the support that that individual needs throughout their journey?
Yeah, and I'll layer in a bit here too. I think we're propelling ourselves here a bit back, but I'm going to spin it back to a question for you. So I wanted you to get ready for that. But a couple of questions coming in the chat around best in class benefits in each of these spaces, which I think we can talk to in a second, but also in terms of how you can solve some of these things and guides, and a couple of questions came in terms of materials. I just want to flag that at the end of this deck, there's a couple of handy guides from partners like the Human Rights Campaign, Out and Equal, as well as some other partners in the space, and a link for Colin and Included Health in there as well. But part of what you'll see in there, I believe it's in the HRC links, that you'll see there's a space in there for employers, and there's also one in there for health providers. So there were a couple of chats in here around guides for health providers. And so I would recommend referencing those guides. It's not linked directly, but it's half a branch from where those other links point you. And then the other thing that I did want to talk on a little bit, because we did have a lot of questions around some of the other area of benefits and the dovetail in here to family and LGBTQ youth, as well as mental health. I think another connection that I'm seeing in my ERG role is, we talked a lot about how to access these benefits, and there's a lot of ERG, CRG, BRG representation on the phone here. We are the population of LGBTQ folks or allies that have a connection, but oftentimes there are folks outside of our community that still need the same help, right? Whether they're parents of LGBTQ youth that are coming out or coming out as trans or non-binary and don't have the same context for what that even means, let alone how to go navigate a complex benefit structure. And so part of what I just wanted to touch on there in terms of some of this ecosystem of stuff that goes around benefits are soft benefits. Like at Accenture, what we've done, and I think the story here is really neat, the history and the trend around parents of LGBTQ youth was always a very, very small demographic of our ERG, or so we thought. It wasn't something that came up frequently in conversations or attendance of events and things like that. But then over the last 2 to 3 years or so, organically, we had a small community of folks that were parents of trans kids, and they were getting together themselves to talk about the issues they were facing in navigating benefits and having conversations with their kids. And we sort of let that incubate on its own organically as an ERG, didn't try and weigh in too heavily in it, but then just started publishing that it existed. We did it not just in our Pride community. We also have at Accenture a parents ERG for parents. And so we started co-publishing in both our space as well as in the Parents Power Network, they call it, for working parents, that this existed. And the population in that group has grown tremendously. And I think it's been great because we've been able to identify a new group of people that need some of the assets we're talking about. Guides for managing gender-affirming care, guides for how to have conversations, lists of affirming providers, and Included Health has been a great asset for us in the last year in really putting that all in one place and having an easy reference to just say, hey, go talk to a culturally competent care concierge at Included Health who can help you figure out where all this stuff is at Accenture. So what they ended up doing is essentially, if someone from our organization calls and says, hey, my kid just came out as trans, what do I do? Included Health will actually come back and say, have you connected with the Power Network or the Parents of Trans Kids Network at Accenture? And being able to sort of close that loop and direct people back to that community has been really helpful in that parents of LGBTQ youth space. And then the other thing I'll nod to here too is also a lot of the conversations, especially with kids, is in the mental health space. It's around getting affirming providers in mental health. And so a lot of the conversation there has been really around finding competent providers that are relevant to you. So that's been another opportunity for us to really zero in on the need of a community, and Included Health has also helped there in terms of part of what they ask in the onboarding process is, are you willing to do telehealth or in person? So if you're able to open up that radius for folks that are saying they can't travel, or that they have to travel 60, 90 minutes for an affirming provider, COVID has actually opened a lot of medical doors with regard to telehealth, which can benefit our community in finding affirming providers. And so asking questions like that and figuring out what the specific needs are have also been super helpful in both the gender affirming care space and LGBTQ youth and family too. And I did start this all by saying I was going to ask you a question, Beck. I don't remember what that question was, but I think there's a lot of conversation in the chat too around what does best in class benefits look like in this space. So maybe if you don't mind touching on that for gender affirming care, and I can maybe try and speak to it for family building more on the fertility, surrogacy, adoption side after that.
Sure, thank you. I think the thing as I'm watching the scroll that I find, quite honestly, you know, I'll say heartbreaking for me as a transgender person and as an advocate who's been doing this work for, you know, at least a decade, is that the questions that I see, you know, the questions, the problems are the same ones I've been seeing, right? Like they, you know, there's been a lot of progress in this space, but if it's not happening for you, it doesn't feel like that, right? And so I think there has been among our companies, the kind of companies you see participating in Out and Equal, the kind of companies scoring highly on HRC's survey, you know, a lot of progress here, but there's still a lot of pain points. And so when I think about the best in class transgender inclusive benefits and gender affirming benefits, I think about a policy and a format that would cover anything a transgender person might need as defined within the World Professional Association of Transgender Health's standards of care. And if you're not familiar with the medicalese and the organizations, that's okay. Even from a community lens, I would, you know, gender affirming surgeries, facial feminization, hormone replacement therapy, our mental health support, our necessary labs and wellness, all of those things that you know as a trans or non-binary or gender diverse person that you may need. And so we look for that best in class coverage being all of that. And I think in addition to that those things are covered, but they're also covered at levels, meaning there aren't caps or barriers that would make them unattainable. So there's the necessary coverage. And then the last part I'll add to a best in class program is access. And so I'll give you a great example of access. I've seen in here a couple of times in the scroll, well, my company has these benefits, but the provider I want to use isn't an in-network provider or isn't in my geography. And so now I've got an additional barrier. I'm either going to have to pay an out-of-network rate, or I'm going to have to pay my own travel costs, and et cetera. And so to reduce those barriers, companies can have very clear approaches to covering travel costs, covering out-of-network exceptions, which means being able to get the in-network rate for someone who's out of network. And listen, benefits and again, here in the US, it's complicated. It's got lots of gobbledygook, lots of language, lots of paperwork, and it makes it really hard. So to me, there are, you know, for those of you in the room who are going to advocate, your ERG members, for those of you who are in D&I or benefits specifically, you can address that in two ways. One, you can use a concierge like Included Health. Or you can, and I'd say or, and might even be better. You can go to your third-party administrators who are fulfilling your plan, and as a customer say, I demand a better level of service for my employees. This should not be so hard for them. I need you to develop a center of excellence, your own approach to making this easier for people. We all want better healthcare outcomes. We will not get those outcomes unless we can make a path to the care for our people that is not so filled with hurdles and potholes and pitfalls. And so, as you are ERG members in the room and you're going back, take that passion and energy and say, look, company, you're spending $1 zillion on this healthcare for us, and it's not working for me. Don't you want it to work? Use your power as the buyer as a lever and help your company do that.
And I would add to that, Beck, for those who are not in benefits, we appreciate when things are thoughtfully brought to us.
Yes.
And there's a gap or a barrier that's brought to our attention. Because sometimes it takes one individual having that poor experience to raise visibility that we're not covering something that we should be, or that we need to make sure that there's a seamless process to get a gap exception when there isn't a network provider available. So we welcome the input, because the goal is to have health equity. And for you to be able to easily use the benefits, they should be available to you. And if we're missing the mark, we appreciate you bringing that to our attention.
Yeah, I'll jump off for, sorry, I was going to try and tackle a little bit of the family building in here as well. And I think Melinda brought up a great point that's a good segue too, is for us that are going through these experiences, writing down and even documenting the pain points, I think is super helpful in building that business case with the benefits team. And again, goes back to this concept of it's the right thing to do. Sometimes it's just a lack of awareness and understanding that you had to go through some difficult process to get there. And I'll tell a story for myself personally there in a second. But in the gender affirming care space, I think on that front in particular, there are a lot of obstacles here that are outside your employer's control potentially, either in the health plans or in the provider structures, whatever it is. And even having a transparent conversation and saying, you are going to be asked this question. This question is probably not going to come off well because of X, Y, and Z. And acknowledging some of that stuff ahead of time has been really impactful too. And I think that's another area where folks like us that are in the ERG, CRG, BRG community, documenting your experiences so you can help coach others that are coming behind you a bit, and help coach your benefits team and help coach other folks in the organization that are helping in this space can be helpful. And then just to take it a little bit to the family building as an example, I consider myself particularly informed in Accenture's benefit structure. I play this ERG role. I work closely with folks like Melinda in my organization around benefits and things like that. I'm on a surrogacy journey with my husband. And when I first started, I knew that Accenture had a surrogacy benefit available. I tried to access that benefit on my own and I couldn't figure out how to do it. And really just relaying that experience that I went through to our benefits team and say, FYI, this is what I had to go through to access this benefit. To Melinda's sort of point, the benefits team was like, holy heck, like that's not what we intended. And all that changed incidentally since then was literally adding one link to our benefits portal that simplified everything. But it's just raising those pain points that really makes a difference. And while I'm talking about family building, I'll sort of talk a little bit about best in class benefits there because it came up a couple of times in the scrolling chat here. But there's a lot to talk about just in the family building space. It's going to be hard to do in our limited time left. And I'm not sure if we've got 10 minutes or if we're supposed to be done now, but 10 minutes more. Thanks, Karina. The family building space, there's a lot that's happening in fertility, in surrogacy, in adoption, and different companies are treating those things differently. In terms of best in class and trends that I'm seeing in my role at Accenture, but also some lenses into other organizations, and Colin, welcome you to weigh in here too. But part of what I'm seeing in the surrogacy space is that benefits teams are realizing that there's an equity gap with same-sex parents that are going through surrogacy journeys. And so many employers are offering reimbursements above and beyond benefits in the fertility space and other things that help cover some of the incremental cost of family building for same-sex couples. That's best in class, I think, from a surrogacy perspective in terms of what we are seeing. Obviously, surrogacy still has a fertility component, legal components, agency components. There's a lot underneath that as well. And in general, employers are saying, we get all of that. We can't solve all of those. So here's one lump sum. And I think we talked about the ranges of those are huge, from like $10,000 to $50,000 per employee or per journey in some cases. I think the mode of that data set is about $25,000 that is offered one time, generally, not per journey, but that's generally what we're seeing in the market. And then sort of, again, in the fertility space, there's a lot of opportunity in fertility as well for LGBTQ folks, rather, sorry, to get similar sort of help. And there's other sort of analogs to what Colin's doing at Included Health in the fertility space. Win Fertility, Clio, Progeny, those are other sort of concierge services that a lot of our companies are using to help navigate similarly in the fertility space. And I think even partnering a little bit with Included Health plus those fertilities to bring LGBTQ competent care to the fertility journey has been a really important best practice for us in making sure that we're getting fertility support. And some of the best practices there are really taking, from an LGBTQ perspective, taking some of the language out that might be difficult for LGBTQ folks or same-sex couples going through these journeys, that are asked questions that are irrelevant to their journeys, and things like that as they're trying to get insurance support or provider support. That's another area in the fertility space. And then from an adoption standpoint, again, there's a lot of fees that go into that from a legal perspective. There's a lot of options even with how you would go through an adoption journey as well. But in general, I think another best practice there worth highlighting is reimbursements for those journeys as well, which is similar to the surrogacy benefit around reimbursing, again, per journey or one lifetime benefit lump sum to help address some of those increased costs of agency fees, legal fees, et cetera. So I tried to hit on a lot of stuff in there. Sorry, I know there's a lot underneath each of those categories, but anything to add there, Melinda, Colin, Beck?
I think one thing I was going to add, which is a little bit of a different angle, is we're starting to hear more and more about the war on talent and employee burnout. So well-being, engagement, retention, super important for those of us in HR. So this is a really good time to say, okay, here are things that I'm looking for that support me. You know, we bring our whole selves to work. We hopefully don't bring all of our work home with us, but having benefits that support you and building a family and you know, becoming who you are, that's relevant. And from a cost perspective, I know someone asked, what drives our benefit costs? Cancer, you know, really premature babies, horrific diseases. This is not, in the grand scheme of things, a big cost driver, but these are significant moments in someone's life where we can really step up as an employer.
Yeah, thank you for that. And I think it ties into one of the questions Karina has been elevating for us, a few that are coming through that folks are really passionate about. One of them being, you know, how to overcome company resistance to change. You know, you've documented, you know, you're making a case, you're raising the issue, and you're just hitting that kind of resistance. I think, you know, one of the things I would lean into is a traditional business case, you know, using your network built here at Out and Equal to map what your peers are doing, not only your competitive peers, say in your industry, but also your regional peers who are fighting for talent, right? Like within your geography, you know, really leaning into that talent case right now is a strong point for your business case, and you know what your peers and aspirational peers are doing is going to be a good lever for you to pull. So I definitely, that's going to be one of your resistance factors. Another would be, just from my experience at HRC, I would say there's a lot of mythology in people's heads about what this stuff costs. And, you know, the benefit space, you know, I have to say, you know, a little, you know, angel wings for folks like Melinda who do benefits work, because honestly, you have to, in the benefits space, say no to a lot of worthy things every day, right? All of our companies are struggling around their benefits costs, and they're saying no to a lot of things that are very important all the time. So we have to lobby to kind of get to the top of the pile and make a case not only around our community, but also the particular discrimination and inequities our community faces that are unique, and really helping folks to see that. But then also kind of educating them around, they have the idea that this is going to cost so much more than what our practical experience as companies tells us. And honestly, the only way to get at costs often is through your network. It's usually highly confidential, but you can kind of get insights into costs by sharing with other ERG members, and kind of networking that way.
Yeah, and I'll just try and pile on very quickly back to I have a slightly irreverent attitude here at Accenture, but one of the questions in here was around what when you're facing that resistance to change, and part of what I'd say is leverage your partners in the ecosystem, right? If your employer has a corporate equality index platinum rating and that's at risk because of what you're facing in terms of benefits that you can't access, use that as leverage. Use your partners. Go call the HRC and say, what are others doing in this space? Use them to compile some of the data points that you're talking about, because they are out there. And I think there was another question on that from Justin around getting that data. Leverage partners in the ecosystem that are compiling this data. It's not great. There's not a lot of comprehensive research out there that's all neatly compiled and stacked and tied with a bow. Colin mentioned a study that he's working on that he's going to be publishing that I think will include a lot of those data points. But leveraging your partners in the ecosystem here, potentially, you know, on top of your employers, can be another helpful way to just get some traction when there's initial resistance from folks in benefits or wherever they might be in your org.
Yeah, so many things that we weren't able to address. I did chat out my email address. I'm happy to be an anchor to connecting folks. Please do go back into the Pathable section and download the slides with the additional information. We do have some hot links and resources there that can help folks. I want to be mindful of time. I want to ask that you please do take a moment to fill out the Out and Equal survey on this section. This gives us feedback and helps us think about in the future how to organize these sessions. Before we sign off, since I've got 2 minutes, I see a bunch about fertility. One of the things I want to mention that we see a lot is the difference between having a fertility benefit and having an infertility benefit, and they actually are different. And you know, for those not in the benefits space, that may be getting into, again, a lot of the language, but it's important to help your benefits folks understand why having to qualify for an infertility benefit as, say, a lesbian couple is a hurdle that you shouldn't really need to cross, right? And that you should be able to get to IVF through a fertility pathway rather than an infertility pathway. And so there are a lot of nuances like this. Some of these guides here have some of the specifics in them that you're looking for about these kinds of questions. So please check out those resources. All right, we're at time. Thank you, Colin. Thank you, Melinda. Thank you, Alon. And thank you to Karina for keeping everything smooth. Thank you to all of you for joining us. Have a wonderful Out and Equal. Please do be in touch with us. We're happy to network and keep the conversation going. Thanks, everybody.
Thanks, everybody. Have a good day. I'm gonna ping in the chat here again. I know we probably still got some more folks on the line here, but I'm gonna ping in the chat back. I know you offered your email address. I'm gonna ping mine in the chat here. Melinda, do you mind?
I won't do that to you, Melinda.
Yeah.
We can serve as a filter to make sure.
Yeah, we'll get to everybody. And Colin, I think you've got your links in there already, which is great, right?
Yep. Yep.
Cool. Is there any way, Karina, to ungo live?